What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I really hope you have a full and speedy recovery with no long COVID issues. It's time now for that Thursday edition of the Pandemic Update for Thursday, September 26th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. There's a lot of viruses out there. COVID is one of them. COVID is still ongoing, and I guarantee you, if you live in a populated neighborhood, or really anywhere with a town over 1,000 population, we'll say, chances are there's someone in your neighborhood that is positive for COVID at this time, or has COVID, and they may not even know that they have it. COVID is still out there in large numbers, even though we're on the backside of this summer surge. We're coming into fall now. We are in fall. Uh, yeah, there's a lot of people sick right now, and there's a lot of other viruses. Cold and flu season. Flu, RSV, they're going to be coming into play relatively soon. Norovirus, that's starting to go up. We're going to talk about that a little bit today. So, yes, there's a lot to talk about today. And if you're new here, welcome to my channel. Want to stay informed? Subscribe down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. By the way, the more people that hit that like button, the more YouTube is going to push my content out throughout the algorithm. Alright, like I said, we do have a lot to get through today, so let's get right into it. Starting off with the news, then we're going to talk about the air quality and pollen levels, and of course we do need to talk about Helene down in Florida, because this is a serious storm, and if you live down there, you need to be prepared for this. So starting off, 2 cases of whooping cough diagnosed in WSU students, and that does mean Washington State University is dealing with whooping cough. We've been getting a lot of news lately about whooping cough cases, and it does not stop there. Whooping cases are also on the rise now in Tennessee. So, like I said, there's a lot of viruses out there that are causing problems at this time, and it is just not good. Taking a look at this now, this is not Leonard Skinner, the band itself. Leonard Skinner had to cancel their tour with ZZ Top, but it's not because the band members are sick. Leonard Skinner band member Johnny Van Zant's daughter had a sudden medical emergency and had to go to the hospital. We don't know what that illness is. It says testing is still being done, and it looks like it's going to be emergency surgery. So we wish nothing but the best to Johnny Van Zant's daughter. And hey, we know there have been a lot of sudden medical emergencies lately. Speaking of things that can happen suddenly, rates of sudden unexpected infant death changed during the COVID-19 pandemic study finds. They say during the pandemic. I hate that line. I just hate that. And I hate to even, I don't even like using the word hate. I just don't like that phrase, because we are still during the COVID-19 pandemic. I mean, if you know a handful of people positive right now, or someone who's been hospitalized, or someone who just recently died of COVID, think about that. It still means you're in a COVID pandemic. And no, I do know that people die of flu, but people are dying of COVID at much higher levels than flu. It's still a thing. Until we can get this below flu levels, I'm still going to call this a pandemic. All right, let's just read this first little paragraph here. The risk of sudden, unexpected infant death, SUID, and sudden infant death syndrome increased during the COVID-19 pandemic compared to the pre-pandemic period, especially in 2021, according to a new study led by researchers at the Penn State College of Medicine. So, yeah, that's not good. Of course, if you want to read this full study, it will be making it on to my website in the archives of studies, some way, shape, or form. It will make it there. All right, moving on now to this. The UK gave its weekly update today, and kind of mixed. They're starting to trend in the wrong direction once again for cases. We saw little itty-bitty rises in the past few weeks for cases. Today was more than a little itty-bitty rise. Weekly cases, 2,213. 7 days. Last 7 days, they increased by 530. That's up by 31.5%. So that's pretty significant. Deaths, down. from here on out, it's good news with the UK. Deaths are down, 89. That is down by 12 or 11.9%. People admitted to the hospital, 1,465. That was down by 104 or 6.6%. But with the cases rising, I would suspect that maybe within the next week or two, we may see a little increase or somewhat of an increase in the number of patients being admitted in the hospital. And you can see here on this chart, it did definitely increase this week. All right, taking a look at heat-related illnesses, there are still some counties out there scattered about throughout the U.S., with the majority being in the southern states, such as the southwest U.S., the mid-south, and Florida, where they are still dealing with some heat-related illness issues. National allergy map, you're going to see here, this is actually not doing too bad. The east, you're fine and dandy today for pollen levels. However, Texas, Louisiana, portions of Mississippi, Arkansas, Oklahoma, and even to some degree portions of Kansas is dealing with the red today, which means your pollen levels are rather high. Taking a look at air qualities, and we will note here that the air qualities are actually not too bad across portions of the Mid-Atlantic, across portions of the East. A little bit of bad air quality across Pennsylvania, but overall, take a look at this map. You're seeing a lot of green. We still do have a few troubled spots out on the West Coast. They're not loading up here, but trust me, they're there. California is still, yeah, there. Take a look at that. Los Angeles, right on up the I-5 corridor, still dealing with some air quality problems. But overall, when we talk about the national level, this is the best this has been in a while. Some of it being for wrong reasons. There's a heck of a lot of rainfall that is occurring from Florida all the way up portions of Georgia, South Carolina, North Carolina, Tennessee. Yes, there is just a lot of rainfall there because of Helene. Take a look at this. This is the major hurricane now. It is Category 3. I usually don't show this during a pandemic update, but we have to today. I got to keep you safe. And you can see here, there's a pretty well-defined eye wall with this storm. And if I was to change radars, you can see here, there's a lot of rain ahead of us. Look at all this rainfall. I mean, major flooding. If you live anywhere, Atlanta, Tallahassee, Florida, the Big Bend of Florida, Georgia, even up into portions of South Carolina, North Carolina, like western North Carolina, all these areas, please be safe. Turn around. Don't drown. And there's red on this map as well. Not as much as there were before. Those are tornado warnings. And real quickly, I have to show you this as well. The latest update from the Hurricane Center just in now has, actually, let's go down here, 120 mile per hour maximum sustained winds. It's a Category 3 storm. It could further intensify to a Category 4 before it makes landfall in Florida. So this is really serious. I mean, yet again, another storm for Florida, and there's even indications down the line that we're not done with hurricane season yet. All right, moving on. More on that. Climate data report is my climate weather Twitter. All right, taking a look at Philadelphia EMS calls yesterday. 811 EMS incidents were reported. That's quite a few. It's over 800, but hopefully maybe we can get that back down again. We'll see. I mean, there were a lot of EMS calls today in the burbs, and at the moment, it still looks busy. 16 EMS calls right now in Montgomery County. How many of them are respiratory? Wow. 1, 2, 3, 4. It's better than this morning. Trust me. There were 27 total calls at one point this morning in Montgomery County, Pennsylvania, which is absolutely ridiculous. And we do see quite a few calls in Chester County, Pennsylvania. Sick person. Oh, I'm seeing shooting with injury. That's not good. Anywho, that's not related to COVID or anything, but that's just not good to see one of those calls. All right, taking a look at what's going on in Canada. COVID-19 viral activity level is moderate. Flu A is low. Flu B is low. And RSV is low as well. Walgreens, the positivity rate nationally this week is 25.3%. The prior week is 26.2%. That is down by 0.8%. Total test, 9,981. The prior week was 10,996. All right, we will take a brief look at wastewater in just a moment, but first, we do have to go to some pandemic update notes. And I do have a note that I did not add here. Like I said, it is likely that if you live in a large populated neighborhood, or even if you live in a town over 1,000 people, someone likely has COVID in your town right now. COVID is everywhere. Believe it or not, I live on a dead-end street. COVID's on my street right now. There was a text that went out earlier today, or someone received a text here earlier today stating that a neighbor who just recently traveled, don't know if that's where she got COVID from, does have COVID. So yeah, COVID continues to go around like crazy. And now for some numbers provided by CJS 83172. And it starts off by saying Florida has 1,171 new cases and 31 new deaths, including one from 2021 and one from 2023. And these are daily weekday reports. New Jersey, 620 new cases yesterday and 4 new deaths. These are from yesterday. New York reported yesterday 1,177 new cases. Virginia added 830 new cases to their open data portal. Puerto Rico added 368 new cases and 1 new death. Weekly reporting states: Arkansas, 68 new deaths reported over the past 3 weeks. Arizona, 2,008 new cases and 15 new deaths. Colorado, 1,884 new cases and 15 new deaths. And it's looking like deaths are going to be high again this week. Indiana, 1,943 new cases and 48 new deaths, most of which were from the first week of August through the first week of September. New Mexico, 796 new cases and 6 CDC reported deaths. Nevada, 691 new cases and 6 new deaths. Tennessee reported 3,001 new cases and 26 new deaths. And the state of Washington just refuses to have a big drop. I mean, they remain elevated once again. 3,144 new cases and 31 new deaths reported there. So that, again, that's some data from CJS 83172. Thank you so much for adding this in the comment section of my videos. All right, let's get on over now to wastewater scan, and we want to do the national level. We're going to go through all the regions here. I think we're not going to do any individual wastewater sites, but starting off here nationally, COVID, it's high. It continues to drop at this time. RSV was starting to rise, then saw a wonky movement downward, but before that, it did see a few drops down as well. Influenza A is rising slightly. Influenza B, it's low at this time. Both of these are still very low. HMPV is low. And Norovirus, since about August 22nd, has been seeing a slight increase at this time. All right, let's go back now and take a look at the Midwest. And in the Midwest, we see things a little bit different. We see COVID was dropping, still listed as high, but take a look at this. It stopped dropping. It's kind of slowed down a little bit at this time. RSV is flat at this time. It's low. Influenza A is low. Influenza B is low. And HMPV is low. And Norovirus, you can see here, a little bit of a rise for that at this time. And now moving on to the Northeast. In the Northeast, we can see COVID levels are high, but they're dropping at this time. RSV is low, influenza A, influenza B, HMPV all low at this time. Norovirus is low, but it's definitely not dropping. It's rising ever so slightly at this time. In the southern U.S., what's going on there? COVID continues to drop. RSV was rising. Now there's a little bit of a wonky movement downward. I think that's going to correct and end up ultimately either flattening a little bit or rising once again. Influenza A, influenza B, HMPV is all low at this time. Norovirus was starting to see a rise, then there was a movement downward. We'll have to see if that changes down the line. And out on the West Coast, COVID continues to drop at this time. RSV remains low at this time after it did start to see rise, but look at this. We're not even talking values over 1. That's really low. Influenza A, still low. Maybe starting to see something rise there. Influenza B is low. HMPV is low. And Norovirus is starting to see a slight increase at this time. Alrighty, taking a look at something now from the CDC, and this is from CDC's Neurostats, has to do with norovirus. And you can see here, as we exited August and came into September, there was an ever so slight increase for number of norovirus outbreaks being reported. So norovirus is starting to become a little bit more prevalent. The levels, they're still low at this time, but you can see here, as time goes on, historically, seasonally, we do see increases for norovirus. But take a look. Back in 2020 and 2021, when we were taking more precautions, look at that. You can see this dotted line here. That was norovirus. There were less outbreaks. They still occurred. there were still some. And as a matter of fact, it peaked at 50 outbreaks at a time. But you can see here, there were less of them. And then, when things went up from 2021 to 2024, you can see it went back to what it was pre-COVID. So, yes, precautions do work. They prevented the spread of norovirus. Not everywhere, but, outbreaks still happen, but there were less than there normally would have been. And we can see here right now, if I had to guess, just based on where we're starting off, it looks like we are following close to last year. We'll have to see what happens. I think this updates every week or every so many weeks. I don't know. I'll keep refreshing it weekly to see if we get an update on this, on Norostat and Norovirus. Taking a look at the latest COVID variant that is in the lead, this will update tomorrow, or is supposed to, which is the KP.3.1.1 variant at 52.7%, and the KP.2.3, which is at 12.2%. All right, speaking of CDC, I don't have it added up here today. This is very important. Matter of fact, I just remembered this. I should have put this up here. I'm hearing reports from people saying, COVID testing, you're able to order those COVID tests now. So if you go to their website, it should work. I'm seeing people saying that they're able to order their 4 free tests. I know, isn't that ridiculous? Just 4. So say you have a family of 4 people. Well, you tested positive for COVID. All 4 of you. All right. How are you supposed to know when you turn negative? You don't have more tests to confirm when you're negative. Get the point I'm making here. Should be more tests than that. Say you're just one person and you like to test each day. You know, some people like to document their case, put dates on the test. 4 tests doesn't do much. It's just totally ridiculous, but I guess they have to have enough to go around, and of course they will, because there's so many people that just don't care about COVID anymore. All right, now moving on to the flu tracker real quickly. You can see Alaska is at low levels, and we do note here, and I forgot to show this last week, Rhode Island has now gone from minimal to low levels of flu. So that is something to keep an eye on. If you live in Rhode Island, good time to go out there and get your flu shot. All right, taking a look at New Jersey, 70 out of 70 hospitals reporting today. 456 hospitalizations, 9 people on a ventilator, in the ICU 42, and discharges 59 at this time. Taking a look at what is going on in New York State, 1,979 new cases. That is a drop this week. We like that. That is a drop on New York City Day. Taking a look at New York State hospitalizations, 242 with 32 people in the ICU. Ohio today, some good news. Well, we start off with good news with Ohio. 6,103 new cases. You're dropping steadily now. Number of hospitalizations dropped, 245. Number of people in the ICU dropped 7. Well, newly people admitted to the ICU was 7. Same thing with hospitalizations. It's 245 more people hospitalized to their grand total of 154,377 since COVID started. And of course, deaths. You know, deaths are the last lagging indicator. It rose from 25 to 39 this week, and the total number of deaths in Ohio, as this refreshes on me, is 44,249. Colorado this week saw a small increase for COVID hospitalizations at 179. Emergency department visits diagnosed with COVID was down by 0.2%. That level is 1.2%. Positivity rate dropped by 1.7%. That is at 11.1%. And cases reported this week, 1,877. That is down by 393. And in the state of Washington, number of people in the ICU for COVID went up by 1 to 22 this week. Alrighty, real quickly before we end out this video, I actually just pulled this up now. You can now order your free at-home test. As soon as I'm done with this video, guess what? I'm ordering my 4 free at-home tests, because you can never have enough testing. But take a look here. Many COVID-19 tests have extended expiration dates, so you may be able to use your COVID-19 test after the expiration date. Blah, blah, blah. That's just totally ridiculous. We're going to be sending expired tests. And then people wonder why, well, I took a COVID test, and it came up negative. Why am I still sick? Some people test again and again, it's negative, and then finally, oh wait, it's positive. When we're using tools that are outdated, is that really effective? No. And they always say, oh, well, we have the tools. Well, yeah, we do, but Our tools are not even sharp. They're like a dull, old, broken pencil. Totally ridiculous. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. If you enjoyed this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. I'll see you all again next time, which will be tomorrow, with new data from the CDC. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.